role on the team is to provide individual treatment plans, help to inform team treatment plans, and also to provide psychology groups within our overall pain management program. The psychological groups take an acceptance and commitment therapy approach, which ultimately helps patients to cultivate a greater sense of psychological flexibility in managing and living with their pain and ultimately living a fulfilling life. Part of the reason for this is because pain can have a significant impact on an individual's psychological, emotional and social function. And it's really about up to 2/3 of chronic pain patients that suffer moderate to severe forms of psychological distress, including depression, hopelessness, anxiety, among other difficult negative emotions.
In essence, what we see with a chronic pain patient is someone who has suffered. They may be confused in terms of their diagnosis. They may have family disharmony, occupational problems, and can often suffer comorbid anxiety, depression, and difficulties coping with their condition. What we would aim to do in the Department of Pain Medicine is to have a multidisciplinary approach using a biopsychosocial model for the management of pain. What we mean by that is that if we apply a biomedical model, which is the traditional medical approach to it, we can often miss out on some of the negative cognitive, emotional and functional problems that patients with chronic pain suffer. We work very closely with our colleagues in physiotherapy and clinical psychology to make sure we address unmet need in these patients. However, we would also be keen to emphasise that we do pay close attention to the biomedical needs, such as the medications and the interventional and surgical aspects that can be helpful for chronic pain disorders.
As physios working with people of chronic pain, one of the questions we're most often asked is it safe to exercise when I have chronic pain? Well, research in this area tells us that exercise is in fact one of the most effective treatments for chronic pain. And the benefits for our overall health and well-being are countless. In our pain management programs, we provide the support and guidance for people who have chronic pain to regain confidence in their physical abilities. We do this through education, helping people make sense of their pain, and we run group exercise sessions in the gym and here in the hydrotherapy pool. The research tells us that exercise of any type is effective, so it doesn't matter what we do, it's just important that we do it.
And the course itself was very well structured from the point of view of having the different disciplines. So psychology was a big part of it, and being able to understand why you felt the way you did or why you struggled as you were at the time was a big thing. But not just to focus on one area of, oh, would you go in and you have a procedure and that's, you know, everything will be better after a procedure. It doesn't often work like that. So it was good to be able to talk things through and to understand how you were feeling or how you could cope with the feelings that you were having, as well as help yourself in other ways with exercise or, you know, different things like that. There was a lot involved in the program that helped an overall experience that you were dealing with at the time.
What we would hope to see is further replication of the model of care for the chronic pain patient in other institutions throughout the country.